Global population up 280% between 1900 and 2020. Water consumption up 840% between 1900 and 2020. Urban population up 2,180% between 1900 and 2020. Net result, number of citizens in water-scarce areas up 500% between 2000 and 2025. Demand will exceed supply unless we manage water wisely. That's the truth. To solve this crisis, we need cooperation, integration, and innovation. Where will the money come from? Measured in dollars, the investment is reasonable. A seven-fold return on investment. By the way, $11 billion is about what Americans spend on bottled water each year. But as important are the human returns on investment in school and work days and in productivity and good health. So perhaps I might ask you the next time you meet Dr. Leitner in Geneva or elsewhere to tell her that I'm trying. Tell her that I understand now that the obstacles are real, but that I don't believe that they are by any means insurmountable. Were we to combine the enormous knowledge, skill, and commitment of all of you with the people and the people who struggle each day to care for the people. There are 4 words in the English language that have common English roots. They are heal, health, whole, and holy. In order to heal in a modern world, you have to provide health. And if you're going to provide help, you have to keep the individual, the family, the community, and the planet whole. And if you can do all of that, that's a holy thing. Thank you very much.
Thank you very much, Mike. I welcome your journey to reach out to the medical profession, as you are too, to all professions, in making water that which is something that we all need to really focus on, in order that as years and years and years go by, it's going to be the major focus for all of us. So thank you very much. I would like to now introduce Terry Bishkoff. Terry, as you see on your program, actually was here going to be speaking on Friday morning in the area of water and health and disasters and conflicts. But she is here today. She is the CEO of American Red Cross in New York, and is leading a transformation of the organization that is strengthening its service capabilities and resources to ensure that Red Cross will be able to meet the preparation and response needs of New Yorkers in the 21st century. She has spent 20 years as a key leadership position at New York University Hospital Center, serving as president from 1998 to 2003. Thank you very much for joining us, Terry.
And thank you for inviting me to this wonderful event. It's great to be back, actually, for my second year in a row. And I apologize to those of you who didn't want to be hearing about disasters today, and we're not intending to come to tomorrow's session for making that change, but appreciate that we were able to do this. And for me, it's actually a special pleasure because I got to meet our last speaker. Actually, it's it's a two-sided coin here. One is I have to follow him, which is a great challenge. But the other is coming from NYU and knowing of him as a great leader and teacher. It's really a pleasure to be able to meet him and to, in fact, be educated by him through his presentation. So that's my special bonus for being with you today. What I'd like to do in the next few minutes is to really talk from the perspective of the American Red Cross and the Red Cross movement about the cycle that we see that we need to address in our world of continuous and apparently increasing disasters, and tie that together with the issues that you're all talking about in this conference relative to water. As I do that, I'm going to ask you to do a couple of things. Come with me on a circular journey that starts with prevention and preparedness, moves into response, then into recovery from disaster, and then once again back to preparedness and mitigation. This cycle that we seem to continuously be in and yet try to deny as we go through our daily lives. So I'm going to ask you to go on that journey with me. And the second is, as you think about the things I'm going to be talking about, if you can help me to think about what you need to be doing as individuals as part of this cycle. For those of you who are part of organizations, what your organization needs to do, and as representatives of government, what your governments need to do, and helping us to be more effective in addressing what we must do in this cycle. Certainly as part of the Red Cross movement and as the American Red Cross, our focus is to reduce human suffering in our country and around the world through preventing, preparing for, and responding to disasters. And we certainly believe that our focus needs to be on prevention and mitigation, not just response and recovery. And as we look at the issues of water in particular, on the area of prevention and mitigation, we actually play a more secondary role. It is clear that governments play a leading and primary role, and I'm going to come back to a little bit of that at the end in terms of what we need to do. Certainly in this city that has been subject to a number of disasters, and for those of us who live or visit here, we always feel we're just a day, a week, a month, some unknown amount of time away from our next disaster. We, the American Red Cross, work in partnership with our local, state, and federal government to prepare and mitigate issues, including what we need to do on water. But I want to go to a minute on what we need to do as individuals. If we know that disasters are not preventable and, in fact, are likely increasing, what have we done to prepare ourselves before we start looking at the larger picture? And so here is where certainly I ask each of you, have you done what you need to do? Do you have your store of water in your home? Do you have your go bag ready when you need to get on those boats that we heard about in 9/11 and evacuate? So just by a show of hands, how many have taken the personal steps to prepare, including your own preparations for having the water that you will need in the immediate hours and days after a disaster? Are you looking around the room? Are you with the Red Cross? A few hands in the back of the room ready. So I think that certainly makes a strong point about there are some very simple steps that we as individuals need to take and that we are not taking. We also need to prepare our organizations, and certainly my chapter and the introductory comments, we are focusing on what we need to do to prepare the American Red Cross and certainly the New York Red Cross for disaster. But if we focus back on the individual piece and how do we engage individuals in preparedness, and how do we importantly engage those people who are more likely to be impacted in a devastating way, which is often the poor. How do we participate in helping our poorer communities get prepared? And certainly we can do that by first preparing ourselves and then being able to lead that effort. And when we look around the world, one of the things I do want to do is to focus on some lessons learned, or hopefully lessons, and we'll tell in the future if we've actually learned from them.